Good day, everyone. So I'm here to share with you about nursing profession. So before we proceed, I would like to introduce myself. My name is Eileen Lopena Amoncio. I am an oncology nurse in Royal Marsden Hospital here, based here in London. And I'm proud to be a Camiguinan, and I'm also a product of Fatima College of Camiguin because I studied there from kindergarten to high school. Just to give you an overview about my nursing path, I took my Bachelor of Science in Nursing in Liceo de Cagayan University. Actually, that's not my first course or first choice. Um, I I took my Bachelor of Science in Accountancy first for 1 year. Then since I found nursing as a very interesting one, so I moved. God moved me in mysterious way because I'm not really a fan of blood, urine, and feces, but I was able to overcome it. The great thing in nursing or pursuing a nursing degree is that having a wide range of opportunities. You can go to a hospital setting or to a community setting. And it also needs a lot of hard work. It's not a cup of tea that you can just spit it if you don't like the taste, because it needs to have dedication and of course money as well. But I tell you, it's not impossible if you have that kind of drive. Yeah, when I got my license, so I worked in Camiguin General Hospital for about 11 years. And I also got the chance to experience different areas in the hospital, like in intensive care unit, wherein we took care critical patients or terminal ones or patients who needs to be closely monitored. And I also able to I was assigned in emergency room as well, dealing with emergency cases like heart attack, accident trauma, etc., etc., and also an admission area. They also have private room, which is this, we call it suite room. There's a different wards like medical surgical wards, wherein you can encounter different diseases. There's an OB/GYN wards, and then pediatric wards where children are being admitted. Few years as well, like when I was still there, was able to assist surgical procedures in operating room, delivering a baby, and taking good care of neonatal patients, like premature patients in neonatal intensive care units, so NICU. So I really enjoyed my job when I was in CGH. So that's my foundation. It's a good foundation for me before I work abroad. And then I remember during that 11 years in CGH, there were many challenges along the way. And one of it was when I took care my sick parents. So yeah, that's the sad reality of being a nurse. You're able to take care of your family member. So that's even my children as well. I remember I also experienced that one. So when my parents died, that's the time I entertained my thought that I need to go abroad. Since I was financially unstable that time, then I thought that working abroad is like it will help me to make my life comfortable and giving us um good opportunity as well. So when I went to Manila, so there was a job offered to me, which is being a mental health nurse. Even though I do have a generic background about psychiatric nursing, so I just grabbed it. And then luckily I passed the exam. They funded me all the expenses, and then I had free airfare, 1 month accommodation when I arrived here in UK, and they also gave me allowances. So which is I'm really grateful. Plus the trust, or my employer is very supportive with me. I was assigned mental hospital, yeah, but it only took me 1 year to have it. To experience there. So I just want to erase that misconception that when you are in psychiatric nursing, it's mostly psychotic patients. No, mental health nurse more of patients who are not mentally stable, going through depression, anxiety, having personal disorders, or yeah, even with children with learning disabilities, they still considered autisms, and they're still considered under mental health nursing. Yeah, it's good that I also experienced that one, but I am more preferred with the physical health. So I transferred to neurological rehabilitation hospital after a year, which I enjoyed as well. I gained friendship with my colleagues, but then I don't have that kind of clinical. I mean, for me, I want to learn more, so I took the chance to apply to another job, wherein it's a cancer hospital. So that's why I'm an oncology nurse, where I can perform chemotherapy with those patients. And there's a reason behind that, because I'm also vulnerable. My mother and my grandmother died of it. That's why I want to know more of the disease process. I want to know more about the treatment, and then even the nature of the disease as well. Yeah, if you want to be a nurse, you should have to have that 6 C's quality. We call it 6 C's. You need to be caring, compassionate, competent. You have to have that courage and commitment. And lastly is having good communication skills, because you need to talk with your patients, of course. And then another challenges for me, as I remember, was during COVID times. It's because I know you will earn good money here in abroad, but at the same time, your life is at stake. I don't want to be buried here. If there's anything happen to me, I want to go home, of course. So that's part of the challenges. But since I've been driven positively, because I need to, I was able to overcome those challenges. I still have family commitments as well. Then after COVID, I learned to listen to my body. That's why I don't do bank shifts anymore, because here, even though you work 3 days in a week, so you still have 4 days off. So that means you can do overtime, or bank shifts we call it here. So you can earn more money. But for me, I need to take care and look after my kids first before anything else. So that's it. You still have more choices. And yeah, and that's all for now, I think. I know what I have shared to you, just a small insight about what nursing career is. I hope it helps, but I'm also looking forward to see one of you become nurses in the future. So thank you. Have a nice day.